Hey guys, it's Bridget from Open Chair Counseling, and if you've been around my channel for a little bit, you've probably picked up on a few pretty important things. One, I'm a mental health counselor, and two, I absolutely love the Enneagram. So I thought it would be super fun to combine those things into a series where I interview a bunch of my other counseling colleagues to get their perspective on what it's like to be a therapist through the lens of their Enneagram type. So in today's video, you'll get to see me interview my very good friend, Nicole Vega, to get her insight on what it's like to be a therapist who's also an Enneagram 1. Now, Enneagram 1s are also known as the reformers. These are the types of people that feel a strong inner drive to improve themselves, others, and the world around them. So without much further ado, let's jump on into our conversation with Nicole.
Why? Why is the world the way the world is,
I know,
Bridget?
and I'm so sorry. Like I don't there are some things that I purposely don't tell you because I know like it's gonna crush your little Enneagram one soul because it's
It
not the
yeah.
right way to do things. But I'm like, but that's how it
Oh,
works. That's the
so
truth.
tough. All right. Professional hat,
All right.
sort of on.
And I've never done this before, so you'll probably have to like give me some pointers. I've never done like a Zoom interview.
Ooh, I'm your first.
You are.
Interesting. Well, I don't remember if I introduced myself or not. Should I
I don't
just do it
know. You
real
might
quick?
yeah, do it right now.
Do it again. All right.
Yeah.
Got the bangs going. So how do I want to do this? All right. So hello, everybody. So I'm Nicole, and I am a clinician slash Enneagram 1. And I currently am on clinical leave, but I was working as a clinician in the beautiful state of Michigan, aka America's High Five.
I've never heard that.
So I'm going to credit myself because in college, I used to always say that as like a joke, like, oh, America's High Five. And like, I never heard anyone else say it. And then, like, I think it was a year or so ago, I heard someone else say it. And I was like, I should have had.
Yeah,
I don't
seriously.
know if you can, but I
America's High
should
Five
have had
TM.
that. Right, love America's High Five. So yeah, work as a or was working as a clinician in America's High Five, and trying to think what else I want to say about myself. I'm 5'10". I like long walks on the beach, preferably on Michigan sand. Just kidding. And yeah, so I'm here to talk about my Enneagram oneness and how
Uh-huh.
that has, I would say, influenced my work as a clinician and as a human and all the things, and how it's kind of helped to grow me and maybe even make me more aware of my strengths and not strengths in and outside of the field. And so yeah, that's kind of that's my intro, I guess.
So I want to do this kind of series based on the Enneagram and how that's shaped or like influenced clinicians. Just because I think it's really interesting to see like how it impacts our clients, but also like from the
Yeah.
clinician perspective, how has their Enneagram type um, like helped them or kind of hindered them in different ways, or just kind of like colored their approach to counseling.
I think this
Um,
is a great idea. I'm like super
Thank
excited to see
you.
all the other interviews. I was talking to Brian about it, and Brian was like, "Oh my gosh, that's such a good idea." And you know how he feels about Enneagram. He's like,
Yeah.
"Nicole, stop." But he was like, "That is such a great idea." Especially I feel like for people who are potentially considering seeing a therapist, I
Right.
think like the humanness that like you could
Mhm.
present with having all different types and why, they're human too. I feel like
Right.
it's so helpful. I feel
And
like the
kind of,
Enneagram just makes it easier to connect. You know what
yeah,
I
for
mean?
sure. And kind of letting people know, like, not that everybody who is the same Enneagram type is going to be the same. Because, like, you're an Enneagram type
Right.
1, but I'm sure that you're very different from a different person who's also an Enneagram type 1. But just to kind of give people a window into, like, what could they reasonably expect from going to see a therapist who's a type 1 or a type 5 or a
Yeah.
type 9 or whatever. And that was one of the things that I really enjoyed, like, working with you when we used to work in the same office, was being able to talk about um, like similar clinical material, but like how we both would approach it or think about it
Yeah.
differently. So yeah, I just
It's
wanted
very
to kind of do
helpful.
like a whole series on interviewing different clinicians who see things differently than I do, and you know what could people reasonably expect? What does that look like to be a clinician who's an Enneagram Type 1? So if
Yeah.
you
I think
want
it definitely impacts things. I mean, I was even just reviewing the oneness and I was like, how in the world was I convinced that I was anything other than this number?
it's
Like it
hard
was
to
kind of funny. I don't think I present
yeah.
very one-ish. Like if you were to like meet me and like see that I'm wearing like my joggers and my house has some dishes in it, it would be easy to think like at the surface level, no way. I'm also like I feel like approachable, which I don't think a lot of ones are. The ones
Mm,
I know in my personal life, they got like resting bee face. A
okay.
lot of them, you know what I mean? Like
Yeah, yeah. Yeah. They're
NG,
very
or mine is
serious.
more very serious. Mine's more like resting confused face. Like
RCS?
choices. Yeah.
Okay.
Like this confused face.
Uh-huh.
So yeah, I just think it's interesting. But when I like go into the meat of it every time, I'm like, I mean, I was looking at, for example, like the core values, the strengths, the challenges, and yep,
Mhm.
yep, yep. Like every single one of them, check, 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 check. The only thing maybe um that I wouldn't check was like the organized
Okay.
box. Don't know about that, but I try. It's
Yeah.
hard. It's hard when you're a mom and you don't have help from family. It's hard to be organized. It just
Mhm.
is. Kind of just like working off adrenaline.
Right. So I don't know if you want to give yourself like a little therapist plug because I know you're not currently practicing right now,
Mhm.
but you are working on some course material and you want to like teach at some point, I think.
I do. I don't. So I don't know how to plug myself because I'm not exactly sure what I'm doing.
Okay.
To be completely fair, I do have a course that I've only been working on for like 3 years.
Only 3 years.
Enneagram one. Here's a plug for how one I am. My course is not perfect enough. Hence, why
It's
it's
not
not
ready.
out there.
Yeah.
Uh, Just
What kind of
can't quite do it.
what kind of course is it?
Well, it has transitioned since I've been
Oh.
working on it for
Oh.
multiple years.
Okay.
So it's more of where I have it right now. It's more of like a mindset. This is the best word I have for it right now. Kind of like a mindset course where I wish I had it in front of me so I could give it better. Like I have it broken down into different categories, but
Mhm.
basically starting at kind of like it's going to be for people who experience like chronic illness in
Mhm.
particular, because like I've had a lot of health issues
Yeah.
and there have been so many things that like I I either thought therapy was gonna fix or I thought naturopathy was gonna fix.
For
Like, I go to
yourself
the
or for other
doctor for
people?
myself and
Okay.
others, like, even
Okay.
my clients where, I was so convinced that, myself and, like, my clients simply needed to see a naturopath and see a therapist, and then they would be fixed.
Mhm. Mhm.
What I didn't really think about is a lot of the things that we know, like the subconscious, right? So, if I'm dealing with, like, a limbic injury, for example, which can very much impede the healing process,
Mhm.
it can create like manifestations of illness. For example, like chemical sensitivity is connected to like limbic impairments.
Mhm.
And we know with limbic impairments, once a week therapy is unlikely to truly fully restructure your brain, right? It's
'Cause it's
because
not
it works
enough?
on no, it works on repetition.
Okay.
So
Yeah.
like when you're trying to heal your limbic system or even like I feel like even super complex trauma that can lead to neural pathways that are just really rigid and impaired, you really need to work on repetition. So if you're stuck in fight or flight all the time,
Mhm.
yeah, it's a beautiful thing to go and get EMDR or a massage or whatever, and that will help you in the moment. But our subconscious is like a 3-year-old. It sees that and goes, thanks for the treat. And then it goes right back to its behaviors,
Mhm.
right? It's like,
Mhm.
oh, well, we've been doing this for like 30 years. So this is what
Right.
we do.
Right.
And so, like, right now, I'm working daily on just super basic things that I completely thought were not enough because in my ego, I was like, of course, I need a professional to help me every step of the way and give me the perfect supplements and the perfect EMDR. And what my brain has really been craving is safety.
Mm.
And so some of the thoughts I struggle with are regarding safety. And so I've been
Are you sure you're
diligently
not a
working.
6?
Right. I know that's where I really thought I was a 6 was the safety thing.
I know we had this
Um,
conversation too because we both use humor to deflect discomfort, and so I was like, "Oh, maybe."
yes, I do.
Yeah.
Yes, I do. I
Yeah.
am very 6-ish, so that's where I kind of am like, I wonder, that's where I feel like I tend to like go, uh-oh, maybe I'm wrong. Oh no,
Mhm.
I'm wrong. I'm a different number. And I feel like that's like almost more one-ish of me because I want to be the right number and get it
Well, and I
right.
feel sometimes very one-ish too because I'm like, "No, it's not the right way. It's not gonna work out because
Mhm.
it's not in the right order. You have to do things the right way or everything's gonna fall apart."
No, for real. That's how I am. I can be very rigid and there is a safety factor to it, right?
Yeah.
And so the course that I'm doing is almost like I would call it like a supplemental guide to use along with therapy or naturopathy to
Hmm.
make it so, unlike me, who has spent thousands of dollars, seen multiple clinicians, multiple or naturopaths, and have gotten a little bit better and then a little bit better. And that's what I hear from clients a lot. Oh, I got a little bit better and then I went back down. A little bit
Hmm.
better. And granted, healing's not linear,
Right.
but like at some point there should be like you're going up.
Hmm.
And I started to notice even the last, I don't know, 6 months, maybe a year that I was working as a therapist, the clients I had that had health issues were doing all the right things,
Hmm.
but their mindset sucked.
Yeah.
And I was one of them. My
Yeah.
mindset was like, someone has to come save me and fix me because I'm
Hmm.
broken,
Hmm.
which I'm pretending not to be. And so I feel like there's this interesting I know culture, and I see it a lot with millennials, where for some reason we just all kind of feel super broken, maybe because we keep going through like horrific
Different.
traumas,
Yeah. Catastrophes, crises,
catastrophes.
traumas. Yeah.
And we all seem to have this mindset that it's going to be like a supplement or a workout program
Hmm.
or the right therapist for like 5 weeks.
Yeah. Do you
And
think it's
so
because
this
all of our moms were on like slim fast diets?
probably we didn't get enough fats in our brain.
Well, I'm thinking more it's like, "Oh, I'm overweight. I'm gonna do Weight Watchers and I'll fix everything." Or like, "I'm gonna do Slim
Mhm.
Fast," or "I'm gonna get a Thigh Master." And that was like what we all saw as
Yeah,
kids. So we're like, "Oh, you just, you pick a thing and you throw that fix on it and everything's fine." I don't know. That's
100%.
I don't know if there's any validity to that,
I
but
mean, I have so many theories. Like, and that's where I feel like my course keeps switching because
mhm,
I
mhm,
feel so deeply that whatever content I put into this world, I want it to actually capture what I'm trying to do. And
mm,
I feel like it's hard because that has shifted with my own health,
right.
my own experience as a clinician, seeing, clients
Yeah.
maneuver the world. And it's just amazing to me as I've implemented very, very simplistic mindset routines, because that's the key, getting yourself into this routine, like this discipline, like turning discipline into a love language to yourself where you're
Mm.
saying, I'm committed to doing this very, very, very boring journaling exercise.
Mhm.
Don't like journaling. This very boring journaling exercise for at least the next 21 days, even if it's stupid, even if I'm literally writing it, I'm going to heal and get well. Oh, this is stupid. No, it's not. I'm going to heal and get well. Like, committing to it. And I've been doing this not even that long now. And I'm already noticing that my fight or flight is down.
Mm.
And I'm like, this makes me feel kind of stupid in a way because I paid a lot of money
Yeah. You're
and
like,
I
"Why
just
didn't I do
needed
this
to
before?"
journal it out.
Yeah.
Just need to journal it out. So I just want to help people, especially those who can't see a therapist every week, right? Have
Uh-huh.
something to supplement them in between. I think that's why I always loved homework as a therapist because even though I wasn't very
Oh.
CBT-ish, but my clients who did the homework
Uh-huh.
would get better,
Well, yeah. 'Cause I
you
think a
know?
lot of it is very behavioral. If you sit in a
Yeah.
therapy office for an hour a week, but then you go home and none of your hours at home are any different, of course, you're not gonna make a whole lot of progress. But if you actually
Exactly.
implement stuff throughout the week and make it part of your routine, you're gonna see changes.
100%. I really think that our brains are so much more simple than what we simple and complex.
Mhm.
But when it comes to creating certain changes, I think we just overcomplicate the crap out of it. We try to supplement our problems away. We try to medicate them away. We try to see 15 helping professionals. And mind you, I'm saying this from a place of experience, not judgment.
Mhm. Yeah, no,
Like,
yeah, I
been
know.
there, done that. Would like to help people not do that. There's actually a beautiful, beautifully written book. It's kind of complex. I actually have it in front of me. It's Switch on Your Brain by Dr. Carolyn Leaf.
Switch on your brain
Oh, it is so good. There is a Christian, she's a Christian
component.
and she includes so she connects it to the Bible. She basically talks about how the Bible essentially is God's guide to like brain training, essentially.
Hmm,
It's actually very, very fascinating. And the
okay.
fact that she can connect, I mean, she knows her Bible. Like,
Hmm,
let me just put it that way. I'm like, dang, how did you connect this to that?
mhm,
And it's a really, really beautiful and simple and loving way to better understand yourself, understand, like, if you are a Christian, God's purpose for you, and that He doesn't create us to be these anxious messes.
yeah,
It's not the goal.
mhm,
No, it's a great book. It's complex. It took me a minute to read it,
mhm,
um, but it's so good.
yeah.
So good. Sorry,
So
I just went on a tangent, and we're
oh,
supposed to be interviewing,
that's
so I'm
totally
sorry.
so that leads us, like, pretty well into our next question of or my next question for you is, what got you into therapy in the first place?
So what got me into therapy in the first place? Oh, I feel like I have multiple ways to answer that.
Yeah.
um, I would say for me, it's almost like really simple, and it might even sound like a little self-righteous or something, but I really don't like seeing people suffer.
Mm,
Like, I just don't. It affects me viscerally,
mhm.
even when I was a kid. Like, I just really didn't like seeing people sad. Um, I'm the kind of person that, I see like a St. Jude's commercial and I'm going to cry. It's gonna happen. And
Mhm.
I'm not really a big crier, but if I see someone in pain, it's almost like I can't help it.
Yeah.
And so for me, I just kind of always knew that I wanted to be a helping professional. I originally thought I wanted to be a doctor
Mhm.
until I realized how squeamish I was around bodily fluids.
Me too.
My lab partner helped me with that. She's like, "So how are you gonna work in the hospital?" I still remember my little blonde lab partner who was like, "You're struggling with this right now," because we were doing an experiment. We had to like touch a bunch of things, and I kept washing my hands like over and over. And she's like, "We're not gonna get the lab done.
Mhm.
Like, chill out."
Mhm.
And so that was cool. And I realized that was probably not gonna be my forte. I thought, okay, well, maybe physical therapy because my grandfather had had a stroke. And I thought, oh my gosh, the physical therapist seemed like the only person who knew what they were doing.
Mm.
So
Mhm.
maybe I should be a physical therapist. And as I was kind of pursuing that, I realized first of all, I really didn't want to touch people.
Okay.
I'm sounding more and more neurotic by the moment. It's cool. It's a good time. But I knew I didn't want to touch people. So I was like,
Mhm.
this is going to be a problem.
Yeah.
And I thought, okay, what am I really fascinated about? What's something that I believe in that could really help people and actually utilize my assessment skill? So I feel like I've always been someone who was good at, maybe it was anxiety, who knows, assessing scenarios. I could
Mm.
kind of always know where people were at, how they were feeling, what they needed. I even had an assistant principal when I was in high school tell me, like, you should be a teacher or something like that. Like, you just
Mm.
see people in a way that I hope you pursue the helping
Mhm.
professions.
Okay.
And I was like, thank you, Mr. Matthews. He's adorable. Really like Mr. Matthews. Shout out Northview High School. What's up? Um, had to make a weird sorry. And so I literally, and this is the funniest part, I thought, okay, well, I'll be a psychologist. That's what I'll do. I'll go to school for like 7 years. No problem.
Right.
No problem. And so I was pursuing psychology, and I remember thinking in my classes that I just wasn't quite vibing with it. I was like, this is weird. I've always loved like my intro psychology classes. And don't get me wrong, I loved some of the pieces of psychology, but I felt like a disconnect in the fact that it didn't feel like it didn't give me like the warm fuzzies, like when I
Mhm.
thought I was going to be a doctor, right? I didn't get that warm fuzzy feeling. And so I randomly took a social work class, literally randomly. I had to fill up some credits. And so I popped into an intro to social work
Mhm.
and loved it. And this is from a girl who was like, I am never going to be a social worker. I don't
Mhm.
want to work for CPS.
Mhm.
By the way, I interned at CPS. So that's interesting.
Ooh.
I love, 18-year-old me. She was so much smarter. She just knew everything I was going to and not going to do.
18.
At 18, I was like, I'm never gonna be a social worker. I'm gonna be a social worker.
Oh, okay. I thought you meant you were
No.
18 when you interned at CPS. I'm like, that's
Oh
so
no, no. I was
young.
20. I
Okay.
think I was 20. It was my
I mean, that's
first
still young, but
internship.
yeah.
I realized very quickly that I was not going to be a good fit for CPS because I wanted to cry like
Mm.
every day. So that was good. And I also wanted to adopt all the children, which would probably have been a problem at 20. So didn't do that.
Right.
Learned a lot though. Learned a lot. Learned to really have a respect, honestly, for
Mhm.
child protective workers. My goodness, people have no idea um, what those folks do and the intent behind it. And
Yeah.
they're great humans, really. And it was interesting too because most of the people at CPS were not social workers. They were people with like criminal justice degrees,
Hmm.
which I've actually noticed even as I've like been in the field longer that is the case in many situations. I mean, there are plenty of social workers, but it's interesting because most people, when you hear social worker, you instantly think CPS. Like I
Mhm.
still get that all the time. Oh, you work for CPS? Oh, you work for CPS? Like, nope, we do other things too. So y'all know. And so yeah, I just kind of I fell into it. I loved it. I knew that I wanted to make a difference. So here's the Enneagram 1 in me.
Hmm.
What I loved about social work was their code of ethics and their mission. Their
Okay.
mission was to stop all injustice, essentially. I mean, you look up social work, like before they became like an actual field of study, they were advocates. They were people that were out in the community that were saying, this is not okay, this is not right. You're going to change the system. I loved that idea of like, I could change the system on a
Mm.
micro, macro, meso level. Like they had me like, my whole body was like, this will make me a good person. Enneagram 1. Like, this will help me go to heaven. Like I was
That's
like, so I was like so committed to it. I was like, this is the right thing for me to do. I'm gonna help all the people. God's gonna be
yeah.
like, good job, Nicole. So Enneagram 1, 1, and 1. He said one's like, I doubt she's a 1. I mean, do you hear it? Like it's everywhere in that
Hmm.
story. So yeah, I guess that's kind of the history behind it, kind of accidental, and then just like this love for advocacy, right? Like I didn't know that I was necessarily going to be a therapist at that point. I just knew that I wanted to, one day look back at my life and feel like I did something, like
Hmm.
something good for someone.
Yeah.
Someone remembered like Nicole, the social worker who helped them.
Hmm.
Um,
Who
so
ended
yeah,
some level of injustice.
yes,
Hmm.
and just oh yeah, exactly.
Hmm.
And you're gonna one again. I do not like injustice. That is very true. But I think, as an Enneagram 1, the problem that I've encountered with that is that I have a tendency towards burnout. So
Hmm.
that's cool.
I think I have read that about ones is that like they tend to just like do and do and do and do and do, right? Like
Yeah.
the
Hmm.
animal that is often associated with Enneagram ones is like a bee. Like they're just like busy as a bee, they're
Hmm.
constantly like flying around and pollinating and like building their little, perfectly hexagonal honeycomb and like
Yes,
doing and doing and doing. That like, yeah, you do burn out. This field is really difficult. It takes a lot of
it
your
is.
own emotional work to be in this field, and that can be exhausting at times.
I mean, for sure. The one thing that I would, caution all other Enneagram 1s pursuing this field is to be really, really mindful of that deep desire to fix everything. And this is why I thought I was an Enneagram too for a little
Mm,
bit. But if you look at like the actual core values and stuff of a 1, they do want to fix things, right? They want to fix what's wrong in the world.
mhm.
Small mission, tiny little thing like that. Um, and so I feel like I wish younger me had maybe been mentored by like an Enneagram 1 who had been there, done that, and could have said, not everything needs to be done today.
Yeah,
Because that's a big struggle. Like I feel like a lot of ones that I've talked to, interacted with, we don't want to just fix the world. We want to fix it by like 8 o'clock
right,
tonight.
right.
So
The sooner the better.
sooner the better, and that's exhausting. And that's why I mean I have burnout on a number of occasions, and that's something that I feel like I've seen a lot more with people who I assume are 1 leaning or maybe 2s um, on the old Enneagram scale. Because yeah, we want to do the right thing, we want to do it well, we want to do all the trainings so that we're the best at what we do.
Mhm.
That gets expensive, y'all, so be careful. Like
I hear you.
so many trainings I've done. So many. But yeah, so I guess I'm not sure where I was going with that. I feel like I was answering the question, but also
How did you get into therapy? Like what
oh,
made you
right.
propelled you into becoming a therapist?
So I guess what finally made me choose becoming a therapist, so I was in graduate school,
Mhm.
and I remember we had to choose at the school I was at to go either clinical or to go more like macro and
Yeah.
be more administrative.
Mhm.
And I had chosen Western specifically for that because I knew that I probably didn't want to be a generalist, which some of the programs are. Knowing, Enneagram 1, I wanted to be really good at the thing I was going to do, and I didn't want to be like mediocre at
Mhm.
like a bunch of things.
Right.
Like I'm not like someone who necessarily wants to be a jack of all trades. I
Mhm.
want to be an expert in the thing I'm doing.
Mhm.
I don't want to make mistakes, obviously. Like no, I don't want to do that. I'm wondering why I got burnt out. Strange.
I can't imagine why.
so, so strange. But I was in grad school, and I remember I was taking a what was the one class I had taken first? I can't remember the name of it, but we had an instructor who was a bit eccentric, fantastic though. She was absolutely brilliant. I feel like my more eccentric professors I learned so much from because they just said it. And I
Mhm.
just remember her talking about doing like psychotherapy and just the passion behind it and like the clinical stories. And I was like, oh my gosh, this woman has changed like a lot of people's lives.
Mhm.
Like a lot of people. And like I was just thinking about like her personality and how kind of like quirky she was. And I always kind of thought I was a little too quirky to be a therapist. Like I mean, we can be quirky, but I was like, I'm like also weird, so I don't know if this is gonna be a good fit,
I mean,
you
you're the
know?
only therapist I know of who rolls into work with a Chris Farley t-shirt on and
Yes,
just,
yes,
like,
I do.
owns it. I love that. I love seeing that shirt.
By the way, I had clients that would request that I bring Chris, and
Yeah,
I'm not even joking. I literally had people like email, "Are you wearing Chris today?"
that's amazing.
I was like, "Yes, I am." Now. But yeah, I'm so grateful that I finally did kind of find my niche because yeah, I was a little nervous, like, maybe I'm a little too quirky for this scene. I don't know. But that professor really kind of changed my perspective. And then we moved into um basically, I mean, I call it a DSM class.
Uh-huh.
So what was that? Was psychopathology? Is
Yeah,
that the
yeah.
DSM class, basically? Oh, I'm dating myself how long ago that was.
Why? I had to take the
two
same
two
class.
years ago.
I
2
literally
years
have my
ago I took
DSM right
it.
there.
Okay, you're young. That makes me feel good. I just couldn't think of the name. I was like, my brain in my 20s could remember the names of stuff.
Oh my goodness.
Right
Okay.
now, it's a bit harder. Let me take a sip of my coffee. So I took that class. Mm, coffee, love it. So I took that the class learning the DSM, and at the time we were still doing DSM 4, which I actually much preferred. I'm gonna be really honest. Don't
Mhm.
come after me, other clinicians who like the new DSM. Well, not new anymore, but back then, DSM 4, I gravitated more towards the structure of it. Again,
Okay.
Enneagram 1, there was a real structure in how you diagnosed. And in my opinion, it made it more difficult to get it wrong. And
Hmm.
so I really excelled, surprise, I really excelled at this very structured way of you know, diagnosing a human to kind of figure out like, here's all these symptoms, here's all this like, information and trauma and different things. Now let's figure out what the diagnosis is, what the GAD score is. We don't use those anymore. Those are a bit more subjective, so
I
I
use
could
GAD.
take or leave. Oh, you do?
I do. Yeah, just as like a measurement tool to see if they're getting better.
I like that.
Because it's
I
all
like
about their
that.
own perception. Like if they come in
Yeah.
feeling like I'm super anxious all the time, I can't handle this, and then
Oh,
after,
sorry, I totally misspoke. Not GAD, the GAF score. Sorry.
oh,
What?
gas. Okay, never
Delete.
mind.
Can you edit that? I totally
Yeah,
just said the GAD score. Sorry, the GAF score. I think that's what it was called. The GAF score.
remind me what
Anyways, there was
gas stands for if you remember.
oh girl, I do not know what I remember. But
Because
basically it was the ending score that kind of tied it all in and like if I remember correctly, it kind of allowed us to know like their functioning level. Of course, I'm gonna blank on this as I tell you that I really liked
isn't it
it.
like global something functionality or something? I don't remember.
Yeah, no, it's something like that. Gosh, I should know this. I can't remember. It's been a minute, but I just loved that there was like the structure. I guess that was kind of it wasn't like any part of it in particular. Like I just liked the axes. I liked kind of knowing where people
Mhm.
like sat.
Yeah.
And what I really liked is that that class was strange. Oh, not strangely to me, difficult for a lot of people, but it wasn't difficult for me. And so I was like, oh, like, am I good at this?
Mhm.
Like, am I like, is this something I'm gonna be good at? And hello, Enneagram 1. Am I gonna be good at this?
Right.
Like, I won't like get it wrong and I'll do the right thing and I'll be a good person and I'll go to heaven and I'll help all these people. Oh, little Nicole, little 24-year-old Nicole. Um, but yeah, I was falling in love with all of these clinical classes. And granted, I don't necessarily align with all the things that initially drew me to the field now,
Mm.
but back then it really pulled me in and I just had this deep desire to um I guess I just again I feel like it sounds kind of like cheesy, but I wanted to help people. I wanted to help people and I'm going to be honest, my ego did love the idea of being a clinician. Like I'm
Mm.
not going to lie. Like I did love the idea of like clinician Nicole.
Mhm.
Nicole who is the clinician. Nicole does clinical work. Like, I liked that, not
It's
gonna
very
lie, my ego
prestigious.
right?
Yeah.
Prestigious. Like, I liked it. I was like, "Ooh, this is fancy." And so, I started kind of thinking like, "Where do I wanna work?" So I started in medical social work, which was very fascinating. Pros and cons, just like anything else. Well, no, sorry, I didn't start in medical social work. I interned in medical social work, started out as a community case manager. Wowza, did I learn a lot.
Mhm.
Um, Personally, I feel like every clinician should do some type of community work, like even if it's an internship. I really feel like I learned, especially now that I've been in the field a decently long period of time, not too long because I'm very young.
Obviously. I mean, look at your skin, it's just radiant.
I mean, I have bangs, like clearly I'm young. I can't even take myself serious. Um, but like I feel like there was this level of person and environment is something that's very important to many social workers, right? Really seeing a person in their environment, how they act, not in my office, which is like not their home. And again, there's pros and cons to every environment in which we see people. But there was something just about seeing how someone was living their daily life,
Mhm.
different times of the day, and just seeing how they worked through. I mean, the community work was tough. I mean, my folks did not have many resources, if any. And I feel like it just made me so much more grateful for, first of all, what I had as a human. And also, as I moved on to other things, I just always feel like I had such a solid foundation for like truly working with folks who are suffering from pretty significant mental illness.
Mhm.
I just feel like it gave me a good, yeah, a good concrete landing pad. And now I don't think everyone needs that, but my personality needed that. Like I
Mhm.
really needed to know that I could work in very difficult situations um and succeed, or what is the definition of succeeding? I don't know. I mean, different for everyone, but feel like
Mhm.
I had really done good work before I pursued what I would have considered, and I don't want to like offend other therapists here, lighter work.
Mhm.
I don't know how to rephrase that. I'm sorry.
Like
You can edit that if you want to.
private practice work.
Maybe.
Know what I mean?
I mean, like work where I wasn't like scared for my life.
Yeah.
So yeah.
I mean, private practice does allow you, like, that little bit of cushioning because, like, it is a person who's coming in who needs help, but it isn't
Hmm.
as severe as, like, you know, somebody who's dealing with, like, a really intense mental health issue. I mean, like, they're at the point that they're stable enough that they only need to see you an hour a week or maybe 2 hours,
Yeah.
and then the rest of their life,
Yes.
they're fine enough to help themselves along. So, like, there's a
Exactly.
little bit of
Outpatient's different
safer.
than like more intensive community work. It
Yeah.
just is. And I don't want to like I want to be very conscientious not to compare the two because I have a very direct way of speaking. I don't want to like be misinterpreted. It's just like when I was working in the community, there were visits that I was legitimately scared about my safety. Like
Mhm.
I was true. I mean, I went into some buildings that like were not safe.
Mhm.
And so I feel like I kind of needed to know that I could do that.
Mhm.
Like I really wanted to do that work first. I feel like for me it was just important.
Mhm.
Um, but yeah, I guess for some people that actually might be like a poor choice, right? But everyone's different. And I feel like although that work was challenging as far as like maybe safety sometimes, clinical practice is more challenging in other ways,
Mhm.
to be fair. So they both have their challenges for sure. I have learned that.
Right.
Definitely learned that.
Right. So how did you get into the Enneagram? What helped you, like, learn
Enneagram.
about it and figure out what your type is?
That would be you, ma'am. You helped get me into the Enneagram. I don't think I even
Really?
knew about the Enneagram before we talked about it. It was you or
Mm.
Adam. Maybe it was Adam. I'm pretty sure it was you. Yeah. Y'all did.
I probably talk about it a little bit more than he does because I think it's, like, so stinking fascinating that I wanna talk to everybody about it.
Right.
I wanna understand everybody. Once I realized that other people in the world didn't think the same way I did, I was like, "I wanna know what they think about then. How do they see things? What do they do?"
It's very fascinating. It really is. I mean, I'm pretty sure it was you that kind of got me into it. I remember even thinking like, so like if I know someone's type, like maybe I can help them
Mm,
more. That's where my brain goes.
okay.
Ooh, I could help. That's where I sound very two-ish probably, but yeah, no, I find it very fascinating. And honestly, I'm not like a big personality typing kind of gal. I've just never resonated with that. I feel like
Mm,
some people absolutely love like the Myers-Briggs and other things. And I think they're valuable tools. My only kind of challenge with them at times is that I would see people get so stuck into like what their type was, especially with Myers-Briggs and things like that, and especially the negative parts of their type, that I was a little hesitant to even look into more personality typing. But I feel like the Enneagram, what I appreciate about it is it just feels like a bit more gentle
Mm-hmm.
than some of the other things that I've, learned about ish. Again, I'm not like an expert in any of the other things I mentioned, but the Enneagram just seems lighter, a little more fun for people. And I
Yeah.
feel like there's 9 types. That's a little bit less intimidating than there's like 72 types or whatever. I mean, again, all psych assessments are different, but
Well, hang on. Let me do some quick math because there's more than nine.
there's more than 9 types of the Enneagram.
Yeah.
What?
Okay. So
My book is lying to me.
nine times 10 times three. I think there's 54 types.
Are you being serious right now?
Well, yeah, because like you are your core number or
Hmm.
plus your wing.
Oh, right. That's true.
So there's nine core types plus there's like two different types for each type because of their wing. So that's what 18.
Oh, right,
And
right. I
then
didn't think about that.
there's social, sexual, and self-preserving.
Jeez Louise.
So that's
I'm glad I don't know all that because that would
so
have
that
like probably that probably would have shut me down. I've been like, just kidding.
so there's like three different types for the other 18 types. So I think there's like 54 types if I'm doing that right.
Oh wow. Dang. I'm gonna stick with the 9 plus the
That's fine.
wings.
That's
Keep it
fine.
real simple. Keep it real
Yeah.
simple. But yeah, no, I think the Enneagram is really fascinating. It's funny too, like as a clinician, I noticed too that I tended to have people that were either type 1, 2, or 6 gravitate towards me.
As
I don't know if
clients.
it was as clients. I don't
Okay.
know if it was purely like coincidence,
Mhm.
but I don't know that I've ever had an 8 that I'm aware of. Um,
Mm.
I've had threes for sure. I usually know I have a 3 because I can't figure them out. I'm like, I know nothing about you. We've met
Uh-huh.
3 times.
Uh-huh.
Help me. How are you feeling right now? Help me understand.
Yeah.
Um, so that's been interesting with some of the types. Like that's how you kind of learn to know, right? Like this
Mhm.
little like cues, and I think that's very, very beneficial. But yeah, I tended to have 1s, 2s, and 6s were the majority of the types that I would see for whatever reason. I
I
don't
get
know.
a lot of threes.
You do.
A
Interesting.
lot.
I didn't get a whole ton of 3s.
I get a ton of women who feel like they have to be productive all the time and they have to keep
Mhm.
up appearances and an image and a persona all the time or people won't love them or appreciate them or take them seriously.
So heartbreaking. Doesn't surprise me in the society we live in, though.
I
I'm
know.
honestly surprised I didn't have more 3s.
Mhm.
I really am. I don't know how that worked because again, like so much of like I think what impacts all of our numbers is like this really interesting productivity goal that we're all kind of assigned at birth, right? Like you look at these kids now, every kid's expected to play like 3 sports and play an instrument and learn another language and and we're living in such a like sympathetic dominant experience where like
Mhm.
I feel like it's no wonder anxiety and stuff is on the rise because
Right.
so much of our value, right, is
Mhm.
what we can do, what we can produce. And so I honestly was really surprised I didn't have more 3s.
Mhm.
Um, right? Yeah, no,
I
I just
didn't
think
go to
it's
US.
wild what we expect. I mean, I don't know. It's interesting. And we try to be a lot slower moving just because I know
Mhm.
what I know about the nervous system. And so it makes me much more cognizant of the expectations that I place on my kiddos. It's so funny because if you would have asked me pre kids, I would have said my kids need to have straight A's. They need to play like multiple sports. Like I would have listed off all the things that I thought. But having learned my children, having had my own experience with nervous system dysfunction
Mhm.
that I greatly believe started occurring at a young age,
Mhm.
I don't want to pursue that same path for my children. And as a one, too, I feel like I was often asking people, it's interesting, too, because I feel like we all have different reasons for it, but there was this like desire to really create a softer experience, even though ones can be a little harsh. I'm very direct. If y'all can't tell in this interview right now, I'm a very direct person, but I'm a very lovingly direct person because I truly, at the end of the day, want everyone to win,
Mhm.
which sounds cheesy, but it's the truth. Like, if everybody wins, guess what? I also win. If the world is kind and believes in themselves and does the inside job, the inside work first,
Mhm.
we're we're all going to be better for it. And so I've tried to really like bring that into my approach as a counselor. I've had to be very, very aware because again, I am very direct and I can come across some kind of way. So I try to be very cognizant. And as a parent too, I'm very direct, and I've had to learn to be just very, very mindful though of like, I guess, kind of knowing my strengths and not strengths.
Yeah.
And I think that's something that actually becoming more of a healthy one
Mhm.
has really allowed for. Unhealthy Nicole isn't about anything I just said.
Mhm.
Like, she's stressed, she's moody, um, she's rigid. And so I think that's an important note too, as clinicians, we have to be very mindful of how healthy we are.
Mhm.
Um, and that's a task in itself.
Which when you said like the she's stressed, she's moody, my mind just went to, oh, but of course then you're a one because ones move to four when they're in stress. So they
Echo
become much
very
more
four.
melancholy and sullen and dark. And I mean, not that like, fours are beautiful.
Yes,
And
fours are
they,
beautiful. A healthy four is amazing.
yeah,
They're such creative humans. Oh my
yeah,
gosh. I have a couple of friends that are fours, and I always know they're fours because I feel like they're very creative and they always want to do all these projects, but like the most unique one of the project. Like, I'm
yeah,
going to do this kind of thing, Nicole. What do you think? But it has to be unique.
and
I'm
different.
thinking of one friend in particular right now who is the sweetest human on the planet, and she's like me. I'm kind of talking crap here, but like myself wants. It's so funny because I want my course to be so perfect in the sense that I want everyone to have such value and to like, essentially walk away having been fixed by me. And hers is more like mine has to be so unique that when people take it, it's never been taken before. But
Mhm.
like both having similar reservations with actually hitting the like, you know, button on releasing our courses. And I just think
Right.
that's so funny about every number, right? We can present honestly, if you met this friend of mine who is a four and just talk to us, you probably would think we're actually a similar number, even
Mhm.
when we're in health, because I do think at the end of the day, a lot of us have have more in common than what we
Mhm.
realize.
Mhm.
I think we have more in common than we do not have in common, but
Yeah.
again, that's probably controversial in the world we live in. I don't know. I don't know what I can say or can't say these days, but um, I just think it's interesting that the Enneagram is just such a beautiful way to learn how to be a healthier human. That is what it's done for me. It has taught me, number one, this is where Nicole goes when she's less healthy. So it helps check myself too. When I start getting into some of these behaviors, I'm like, oh, okay, course correct time.
Yeah.
And a healthy one, like a healthy Nicole, wants to go on adventures with the kiddos, wants to go like to the park and do all these fun things, and
Because
is
they're the
actually pretty
seven in
chill.
health.
Right? I do. I actually go to 7 and I'm actually
Yeah.
pretty chill. When I'm healthy, I am not one-ish at all. I would say I could easily be like maybe not a 7 because I am still very like I want to plan things out and, and
Right.
whatnot. But like I don't think that me and health really like looks like an Enneagram one, which is something I also wanted to mention here too for people who think they know what every number is, right?
Mm.
I was guilty of this, like thinking that ones act like this, twos act like that, threes act like this. Like we are kind of talking about earlier, you put 5 ones in a room and we could all be very, very different
Mhm.
humans,
Yeah, both of
you
our
know?
husbands are fives,
Yeah.
and they're very different fives.
Mhm.
Mhm.
For sure. I can't
Yeah.
remember where fives go to, but I think you and I had discussed that mine has a different wing than yours because mine doesn't tend to
Um,
go to the artsy side.
Adam
Like the
is a four wing. Sorry, he's a five wing four.
That's right.
He's a very weird. Like he seems kind of emotionless and rigid, but like underneath the surface, he is a puddle.
Aw,
Um, like
I love
you
that.
put a Hallmark movie in front of him, and he's just weeping. It's
Respect.
very bizarre.
Okay.
And
I
I
like a
think
Hallmark movie too.
I can't stand them.
I love them.
I can't. They're too
Brian
sappy and
tolerates
too
them.
unrealistic. I think Brian is a five wing six, if I remember
Yeah,
correctly.
I would say that for sure. He's not like Hallmark movie time. He'll do it for me, But yeah, no, he's very sweet though. He's like the kindest human that I know. My husband is so sweet. But
Mhm.
it's interesting that dynamic. A 1 and a 5 is an
Mhm.
interesting dynamic, let me tell you.
I believe
Because
that.
ones have a very strong inner critic.
Mhm.
Like, you don't have to tell me what I've done wrong. I
You
have
already
thought
know.
about it
Mhm.
57 times. Like, even if I didn't do anything wrong, I can find ways that, like, what if I did it a little bit more this way and then it became wrong?
Mhm.
Uh-oh. And so what, my partner and I, my husband and I have had to really navigate is because we're both very direct people,
Hmm.
and his sense of humor tends to be a little jabby at times because that's the
Yeah.
humor he grew up with. Like, that's how they all are. They kind of pick at each other, like nitpick stuff, and that's like their dynamic. That's not how I grew up. So I just, it's funny sometimes he'll say little zingers thinking he's flirting and he's truly offending me. And so
Mhm.
I've had to have conversations with him, and this is after I knew the Enneagram actually, where I've had to say to him, you are hitting a core wound when you are making those jokes.
Mhm.
Like, this is not working. And thankfully, I have a partner who goes, oh, okay, gotcha. I'm not going to do it. Like,
Right.
he's very respectful.
Yep.
But that's another way I think that this personality typing can be so beautiful is to better recognize not only how I need to be communicated with, but like how can I communicate effectively with someone else so they know how to communicate with me. Like,
100%.
communication is sprinkled all in there, and I feel like that is probably one of the things I like most about the Enneagram.
Mhm.
Just helps with communication, which a lot of us are not as good at these days.
Well, yeah, it's we constantly have to work at it. And that's what I
Yeah.
always tell people about the Enneagram, at least for me on my journey of, the first time I ever heard of the Enneagram, I thought it was like complete bullshit. Um, I really did. Like I was like, this is ridiculous. It's made up. It's so like loosey goosey that anybody could fit into any category and it's just stupid. But the more that I learned about it and the more I realized like, oh crap, like somebody sees me
Mhm.
and like understands what it's like to be inside my brain. I don't know how they did that, but they knew what it was like to be inside my brain and
It's
it put
amazing.
it I tell people this all the time. I swear learning about the Enneagram and learning about myself and learning about Adam was what saved our marriage in the beginning
I
because
think it's helped my marriage too, to be very honest.
yeah, like we were absolutely in love. Like I love him to death, but in the beginning of our marriage, we did not know how to communicate
Mhm.
and learning about the Enneagram put language to things that I didn't know we needed to talk about. I thought like he should just understand this about me or I should just understand this about him. And both of us were completely missing each other because we didn't know that that was something that needed to be talked about.
Yep, it's amazing how it can be such a beautiful tool. And what I thought was interesting too, like my last probably like year in practice when I would have clients bring it up to me and be more of an expert in the Enneagram types than even I was. I was like, "Oh, excuse you coming in here and knowing more than I do." And I
Right.
would let them know sometimes, like, "I don't know about that." But I got this girl, Bridget, like, she knows about it, so I go ask her. But, like, I think that's another thing too about I guess if we're talking about ourselves as clinicians, I tend to be a very direct clinician, which I do think goes back to my type, right? I'm
Mhm.
very direct because I don't want there to be any miscommunication,
Right.
misunderstanding, hurt feelings.
Right.
So even on my consult calls, before someone becomes a client, I would be very clear. I am direct. I am not a passive therapist.
Mhm.
If you're looking for that, I can recommend some wonderful humans and I would totally honor and support that. But if you're looking for someone who is going to like get in the mud with you. Like, that's how I work. I'm not gonna
Mhm.
sit there and go, "That mud is brown. How does it feel warm?" No, I'm gonna get in there and be like, "Let's get you out of the mud," or, "You have a tool for this mud? Can we, like, clean the mud off?" Like, I that's just how I am. It's how my brain works.
Uh-huh.
But because not everyone is down with that, and for some people with their depending on their trauma, their experience, that might actually be super inappropriate and not helpful, right? So
Mhm.
I'm always very transparent when anyone wanted to work with me, like, this is how I work. And I think again, the whole Enneagram wanting to be a good person was a huge reason why I did those calls and why I was so clear because I didn't want to do something wrong or create any kind of discomfort for someone when I could essentially be a good person and find them someone better
Mhm.
that maybe better aligned with them.
Mhm.
And so I just think like again, it's amazing how much the oneness in me came out all the time and I had zero idea that that's why I was operating that way. And I think even like, in session there was a level of I think this is probably what led to some of my burnout a level of just really wanting to be in it so that I could do the best job possible for every single client I saw all day long. And that's an impossible task, I think, especially during a global crisis event, like that was rough. And so I think, acknowledging what works for us, what maybe doesn't work for us is a really big piece. And even as a client, who maybe is watching these videos today and thinking, gosh, does it make sense for me to know what my therapist type is? I mean, I wanted to know mine. I flat out asked her. I'm like, I need to
Mhm.
know what you are. Like, I just need to know, like, because I'm just curious. Because for me, I desperately wanted someone who was opposite of me,
Mm.
truly. Like,
Mhm.
and she's an Enneagram 7.
Mhm.
She's like, a little more bubbly, a little more whatever. And I needed that because I didn't want necessarily someone who was going to be as direct as I am. Because I got that under control there. I can do that. I can do that.
All by myself.
So we're good. So I just think that's kind of an interesting thing to maybe consider as a potential seeker of therapy. Like, would
Yeah.
this be something I would want to know about?
Mhm.
My clinician. I think it's fair to ask. I mean, I
Yeah.
think there's a level of transparency that is almost needed depending on, I mean, if someone has complex trauma, there are certain disclosures as a therapist that I think, and again, some might argue this, are helpful for safety and for someone to feel like they have more choice in
Mhm.
understanding of what they're walking into,
Mhm.
you know?
Yeah. So you would say that some of your strengths as an Enneagram type 1 clinician is that you're very direct and you're very concerned with like, I want to make sure that I help this person in the best way possible, even if that means it's not me.
Yes,
Yeah.
100%. I
Okay.
would rather refer someone out if I don't think it's a good fit, because at the end of the day, I did not become a clinician to just meet with people
Mhm.
and take their money and bill their insurance so that I can have a full caseload. Absolutely not. I would rather have seen a third of the caseload I had with the clients that I could best serve. And that
Mhm.
was why I was very niched and I was very, specific about who I felt I could best support because again, I want to know that if you're spending your time with me, your money, your resources, that I am a good fit for you. And if I'm getting an inkling, even on a 15-minute phone call, that
Mhm.
I'm not your girl, I want to do the right thing. No, I even said it. I want to want to do the right thing and send you to someone who I think really would be of service. And I did that a few times. I had lovely calls with people that I was like, I think you and I both know this might not be the best fit for you. And it's always nice when they agree and they're like, yeah, like
Would
you're
they
my
actually
girl.
say that?
I've had a few people that are like, "Yeah, I think this might be a bit much." And I mean, that was fine because we laughed about it. It was
Uh-huh.
like I can't remember, how many times that happened, but I did have a couple of people that it was like pretty obvious
Oh,
that it
wow.
wasn't gonna mesh. And it was
Okay.
what the beautiful thing was because I think of how transparent we both were,
Mhm.
we got that out in 15 minutes versus a 60-minute session.
Mhm.
I mean, oh, how painful for that person. I mean, I can sit in discomfort, like, no problem. I trained for this, right?
Right.
But like, I don't want to do that to someone else. And it's interesting too, because sometimes it's things that like you wouldn't even think would be like a deal breaker. Um, I mean, there were times where I'm pretty sure, even when I was a medical social worker, that like some interactions went awry because I reminded them of someone like, in their past that they didn't like.
Mhm.
Like think of like some of the things that we don't think about as humans, right? Like certain names that can bring us back to experiences. I mean,
You
there are
don't think about
certain
that?
names. No, I do think about that.
Oh, I
I
was
do think about
I think about
names.
that all the time.
I mean, stuff like that. Like, I mean, it's amazing to me how, like, when I was naming my kids, there were certain names I was not going to use, even
Yeah.
if I liked the name. And so
Yeah.
sometimes I think, devalue
Mhm.
things that are going to be a problem. Like, if someone's coming to me because they wanted to work on, let's say, the recent loss of a child,
Mm.
I don't necessarily specialize, again, depending on the situation and what they're looking for. I wouldn't say that that is my expertise. I would say, yes, trauma is an expertise of mine. Grief and loss comes along with trauma, but there was a couple scenarios where I had people reach out to me that I did know. I knew that there was a clinician that even if we were going to be a good fit, I knew that there was a clinician that was more specialized for their situation.
Mhm.
I'm thinking right now actually of my mentor for a couple of people who came to me that I was like, I just know he is better suited for you. Like
Mhm.
I just know it. And it's really nice when someone is in agreement, but I did have a couple people that were like, "Nicole, I mean, I was recommended to you. I know we don't maybe like see eye to eye on X, Y, or Z, but I really want to see you." And
Hmm.
then we can work on that, of course. But I think, informed consent or whatever you want to call it,
Yeah.
I want to make sure that folks know kind of where I'm landing and where they're landing, that they always have choice. That if they do want to pursue therapy with me, they're not stuck with me.
Hmm.
I would bring that up a lot with people, especially if I felt like there was something bubbling that they were too afraid to say. And I mean, it's
Hmm.
amazing to me. There was a couple interactions I had where I had a client and I was like, "We ain't vibing, are we?" And they were like, "I'm just gonna say it. We ain't vibing." And the look of relief on this one person's face in particular, you could just tell she was like, "Oh, thank goodness."
I wasn't the only person feeling it.
Yeah, but she didn't want to hurt my feelings.
Yeah. Yep.
And then I referred her to someone else who was a way better fit,
Hmm.
and she even emailed me and thanked me. I can't remember how many months later it was, and I was like,
Hmm.
"That's awesome."
Yeah.
You know what I mean? And that's where I think again my maybe it's more I mean, I don't wanna blame everything on my Enneagram type, but I do think that these are one-ish qualities,
Hmm.
Like,
Yeah.
so yeah. I'm giving you very lengthy answers. I don't know if you wanted, like, the super
I love it.
in-depth answers.
Of course. Okay, so yeah, so you would say that burnout is kind of more of like a shadow side of like being a one because
Yes.
you just feel like you have to fix everything. You have to do it to the best of your, best of
Mhm.
your ability, which sometimes means that you drive yourself into the ground a little bit.
100%, 100%. I mean, I've hit burnout like 3 times in my career,
Mm.
and I'm not that old, people. For those of you who don't know my age, I'm not going to share it today because it's my own personal business. Um, but I at my age, I probably should not I wanna be careful how much I say should. Burning out 3 times already is a lot.
Mm.
And granted, I had personal circumstances, and I am a mom of young kids, and we did have
Mhm.
a global,
Pandemic.
pandemic. So there have been some things that have made it hard, but I think I'm just gonna say it, why not? Let's share this with the world.
You did say you're very
My
direct.
I am, and I don't lie, which is cool. Brian loves it. That's why he always asks me questions. Um, Sorry, Brian's my husband, folks, for those of you watching. Um, so my boundaries were poor. Just gonna say it. I did not have great boundaries. Not a surprise to you, my friend. I know you know me. And the fact that tended to I tended to overextend myself. I tended to see probably too many clients at times in a day, in a week. Um, I would switch my schedule a lot to meet my clients' needs. Like if someone was like, "Nicole, I got to see you today. Like, can we meet virtually at like 9?" There were times I did it to my own detriment.
Mhm.
And that's where I think ones have to be so careful because I was operating from, especially in the times we were in over the last couple of years, I was operating from this place of like, it is my job to save all of these people.
Mm.
I didn't consciously know that,
Mhm.
but my subconscious
Mhm.
clearly did. My body, like, I was so in this mode of having to show up no matter how tired I was that I did myself a disservice, and which is why I've paused my clinical practice for now, and I'm taking a leave because
Mhm.
I feel like I burned myself into the ground a little bit.
Right.
And that's something that I'm going to be transparent about because I know I'm not the only helping professional that's done it or is going to do it or is in it,
Mhm.
you know?
And when you said I have to save everyone, I could feel like a visceral reaction in myself of like, what? No, like, it is
Hmm.
not my responsibility to save people. I am not that big. I am not that strong. I can help
It's,
you.
yeah.
I can help you. Like the way that I think of being a therapist is kind of like, um, we're both like walking around in the woods and like
Mhm.
I have a backpack with more stuff in it than you do.
Yeah.
So like I might have better tools or like more tools that I can show you like, hey, look, I got this compass. Hey, look, I got this map or whatever, band-aids because I always have band-aids. I'm 6. Um but like it's not my job to save you, but I can help
Mhm.
walk with you and show you the tools that I have and maybe those tools be helpful for you and maybe they're not, but like I felt like a in my
It's a
chest.
lot.
It's my job
It's
to save
a
people.
It's a lot. And honestly, one thing I've always really respected about you, Bridget, is that you have good boundaries. Like you are really, I mean, you're so much wiser at your age than I was as a clinician with just really respecting like your time and like what you have available. Because at the end of the day, if you burn out, you're not helping anyone.
Right. And I
I
wanna
was so
be
busy. Oh,
I
sorry, go
wanna
ahead.
oh, no, you're fine. I wanna be in this for the long haul. So I know that
Yeah,
if I use all of my energy now, I won't be able to do this, 5, 10, 30 years down the road. Like,
exactly.
I have to pace myself. I know that over time I'm gonna get better at this, and it's not going to take as much of my energy as it might right now, but I
Mhm,
can't dump all of my energy. I can't have super open. I would like to say that I have openness with my clients, but, like, there are
mhm.
still some boundaries where, like, there's just
Yes.
things that I'm not going to talk to you about, or there's parts of my day or of my week that I'm not going to give my clients because I need that for me
Mhm.
to, like, regroup and have some
Yes.
free time and, connect with my husband and with my friends and my family and stuff. Like, I need to have those boundaries or I won't be able to do this job long term.
No, it's so smart. I think my biggest issue, because I had very solid boundaries in many ways, especially like in session.
Mm.
It was the emergencies or the urgent things that I was acting like a crisis worker at times when I'm not.
Well, that was your
That's
training, though.
yeah, this is true. And I think I think we have to be honest too with ourselves. And it's hard for me to say that I burned myself out, but I believe now, not a little while ago, I believe now in radical responsibility and like really owning
What does that mean?
what so owning the stuff that might not even fully be my fault. Because knowing that at the end of the day,
Mhm.
whether or not how I got to burnout was me or not,
Mhm.
I'm the one that has to fix it. So I'm going to own it. I'm going to own my role in it, whatever the case is or whatever it might be. And I'm
Mhm.
going to do something about it.
Mhm.
And I tell you one thing, my boundaries going forward are going to be much more firm. And I'm not going to deviate from that ever again because I've finally learned the lesson. I think if you don't learn the lesson, you repeat it and you repeat it. And I finally had to talk with God and realize I'm done learning this lesson.
Mm.
Like I'm done learning this lesson. I think the unfortunate part is I really feel like at the end of the day, I was the clinician that really cared so deeply. My
Mhm.
intent was so pure
Yeah.
that it felt really um frustrating that that then led to me not feeling well. Because I felt like I was doing the right thing, right? So shouldn't I be rewarded with
Right.
more energy to
Yeah.
do more right things?
I mean, that would seem
And
fair.
right, it would seem fair, but
Yeah.
I think that's where we have to remind ourselves that we just can't pour from a cup that we're not filling.
Yeah,
Like
for
we're just
sure.
pouring air at that point.
Yep.
And I think some of us lean more that way just by probably biology. Who knows, right?
Mhm.
But becoming aware of that is so key. And just, again, going back into the work and being very available and using, that deep desire to help, but also that learning of okay, but there has to be boundaries. There is this quote I had read once, and it was like, I think it was referencing like Enneagram twos or something, and it was saying that basically they're the person that's like on fire, getting water and dumping the water on everyone around them
Except
while they
themselves.
are on fire.
Yeah.
And that was me. I was making sure that you're not on fire, you're not on fire, you're not on fire. And the really interesting part was I started to realize my clients were doing really well,
Mhm.
probably better than I. And I had to really think to myself, okay, Nicole, like when are you going to take care of you like you do those you support?
Yeah.
Like you don't want to be sick, right? And so I had to pause and I stand behind that choice. It was the right thing to do. It was the right thing to do. I think even for the people that I was serving, to refer them out to people who had more, what's the word I'm looking for?
More
More
band.
vitality left in them,
Okay.
are
Yeah.
able to be of service. And so
Mhm.
yeah, there's good and bad to being a one. Again, I don't think anything is perfect. We all have our stuff.
Right.
And yeah, I've had to learn, lessons, as most clinicians who are honest will tell you that they've had to learn too. I'm not the only clinician that's burnout or had different things happen. I do notice that I tend to be the most vocal about it. I've had other clinicians like low key DM me on Instagram or Facebook and be like, "Thank you for sharing what you share. I would never be able to share that."
Mm,
I'm like, "Oh, that kind of like makes me sad."
mm,
Like you're afraid to share that you burn out. Like I know you're not in the field either right now, and I know why.
mhm.
Like, but some people just aren't able to go there, and I am because I again can't lie. So
Yeah. I think
you're
that
welcome.
there's like a couple things at play there. I think it's shame.
Yeah,
Like if I'm telling other people how to take care of themselves, I should be able to take care of myself. And
yeah,
like that word should, like I should be able to do this carries so much
hmm,
shame. And I think also
yes,
there's a fear too of like, well, if I admit that I'm burning out, then people aren't going to want to come see me and then I won't make any
hmm,
money. And like, this is how I make a living. This is how I put food on my
yeah,
table. So I think there's a fear of like, I don't want to lose my livelihood if I say I'm burning out.
yeah. No, I totally get that. I think for me, there was probably a level of like, I want people to know that I'm burning out, so nobody tries to work with me.
So people leave me alone.
Like, because it was hard, I mean, in our area, if you're an EMDR therapist, you're in demand always, especially right now. And so that was hard for me to know. Like, if I walk away, there's one less EMDR therapist available. That put a lot of pressure on me.
Although
And
EMDR is
so
becoming a lot more popular though.
it is, yeah. I'm still seeing so many people that cannot find an EMDR therapist. Are they all
Really?
full? Like,
Probably.
I don't know.
Mhm. Right. But I do think, like, just kind of on the topic of like you saying that you've burned out 3 different times, and so you've kind of shifted what you've been working on. I think that is one of the really cool things about our field is that there is so much flexibility so that you
Yes.
can do like community mental health and then switch to private practice and then decide like, okay, I'm getting burned out, so I'm going to start writing a course.
Yes.
There is so much cool stuff that we can do in
So
the mental
grateful for
health
that.
field to help people. It doesn't always have to be the same thing.
Yes, 100%. There's value in all of it. I
Mhm.
think one thing I've learned being a more seasoned clinician at this point is that there are so many different ways to help. I always thought that helping meant I had to be one on one in a clinical setting.
Mhm.
And now there is so much value to that. And let's be honest, right now, we need more therapists than ever.
Oh, heck yeah.
Right now, we
Yeah.
we need all the therapists. So I am again not taking from that role, that work, that's beautiful work. But I think it's also important to acknowledge that there's other ways we can be of service. And again, I don't have to probably list them all here, but I had to really get away from that rigidity of like, I have to do one on one work. I have to do one on one work because in this season of life, as a mom of young kids with schools closing and opening and then closing, it just wasn't working.
Mhm.
This wasn't working. And I'm not going to be a therapist who, um, like, when I got to the point where the burnout was quite clear, that was when I realized I had to start transitioning out and referring people to other people
Mhm.
because I am completely unwilling to not be fully well,
Yeah.
trying to show up and be of service. That's not fair to my clients or anyone's clients or anyone. And while I'm sure I had clients that would have stuck with me, even if I was like, you know, who knows what, like half asleep in the session, but I would never do that to someone. Like that's just not like okay. And
Yeah.
so I think it's something to really, be mindful of if you are feeling that burnout. I know not everyone has the privilege to walk away. And trust me, it took me until this age to have this privilege, so I recognize it. Um, but there are different ways to transition. One way that I handled burnout previously was switching where I was working, right?
Mhm.
Like when I was working in the, community mental health and I was like, oh man, I don't know if this is going to be sustainable. I switched into medical social work and then I switched into clinical work. And so, yeah, I think sometimes even just a change of scenery,
Mhm.
doing something somewhat different is a really beautiful way to still be of service, but not be hurting yourself in the process,
Yeah.
you
What's
know?
so funny is that when you said you switched into clinical work, your headphones kind of like shorted out for a second and it sounded like you said I went into Nicole work. And I was like,
Oh, really?
that's such an interesting way of putting it. I went into Nicole work because you're Nicole. But you said clinic.
Sorry, that's why I keep putting them by my
No,
face.
you're
These are
good.
super
You're good.
glitchy.
I just like I realized that like, oh no, she said clinical, not Nicole. And I was like, but both ways it could have been like both ways it made sense. It was
Nicole
so
work.
beautiful.
The inner like narcissist in me is like, yes, Nicole
Oh,
work.
stop. I have to
Oh
do Bridget
goodness.
work too. I have
We all do, right?
my own crap to work on.
We all have our own stuff. But yeah, I hope that that was helpful. I know that we um kind of, talked about different things today, but hopefully there was some good nuggets in there. I felt like I I shared a little bit more than I was planning on sharing, so that kind of surprised me. So
Oh,
look at me being all transparent
I
and
know.
stuff.
Look at you. Well, I do really enjoy your input and value like the way that you see things and feel things and, you know, the way that you want to help other people, the work that you want to do. So I love that you were able to share stuff and I do think it was helpful for me and I think it's going to be helpful for other people who watch this video.
I sure hope so, because obviously the Enneagram one in me wants this to be of total value to everyone, and I want it to be like I want people to
Mhm.
like it, and subscribe to it. Um,
You know, that's always something I forget to say. I don't think I've ever said that in any of my videos of like and subscribe because I always forget to do that. I don't want people to feel like they're obligated to do anything for me. It's just like, here's this thing that I put out into the world. If you want to watch it, that's cool. If you don't, that's cool too. You don't have to do
look
anything.
who's showing her Enneagram number right
Like,
now.
I don't want
Okay.
you to feel like you have to do anything. You don't owe me anything. But
You've got good content on there. I'm so excited to see the other interviews you do. I am definitely going to be checking them out because I am really curious too to see how other therapists of other numbers respond and act to things. I'm really curious to see you interview an eight.
I have somebody in mind, but it was hard for me to think of someone because all of the other therapists that I know are twos.
Yep,
Like,
that does
well,
not surprise me.
not all of them, because I
They
I
are
have
plentiful.
I have someone in mind for every one of the numbers, but, like, most of the people that I was running through, I was like, "Nope, they're already a 2. Nope, they're a 2. Nope, they're a 2."
Twos sure do make up our field. And thank
I
goodness.
know.
I love a two because
Yeah.
twos are such, they're kind of like ones in the sense that they're just like little helper bees. They want to go and they want to help everyone, but
Yeah.
burnout is also a thing for them.
Yes.
So
Very real.
yeah, I'll be curious. And I want
Well, I think you answered all of my questions, but is there anything else that you wanna add? Like
anything. I don't know. I feel like in my mind before we met, I kind of had an idea of like, oh, I want to add things, like not like concrete, but I was like, oh, I might be inspired to say something along these lines.
yeah.
But I feel like we had such a flowy conversation that I don't even know that I have like an add on
Okay.
that I can think of. Think. Mm, I don't know. I was looking through the Enneagram earlier and I was like, well, maybe I was like wanting to say something. I can't remember what it was, but I might have already touched on it. Oh, I think when I was looking at the wings, how it was like so evident that I was like a two wing. I was
Mm.
like, maybe I'm a nine wing because I have like a couple of good friends that are nines and I get along really well with nines. I'm like, I bet you I'm a nine. I was looking at the wing, one wing nine and one wing two, and I was like, I am not a one wing nine. They're like, what was it? It's to be composed, reserved, and have a calming nature.
Hmm.
No. Their
Yeah.
emotions are less readily available, but when they do surface, they're natural and not overwhelming. No. Um, they are highly idealistic. Okay, yes. And when under stress, they come across as condescending. Also, no. I really, of all the things, I'm very sarcastic, but I'm not condescending. I think that's like that's so rude. But then I was looking at the like wing two, and it's like ones with a strong wing two gravitate toward people and social settings. When I'm really, feeling good, that's what I do. They
Mhm.
enjoy being helpful, generous with their time and effort, but they can also be a bit self-righteous. Yes, with how they expect things done and do. One wing two can be passionate and have strong opinions. Also, yes.
Mm.
Also, yeah. So it was so funny because like I don't know, I was, like, re-looking at some of this stuff, and I was like, "Oh my gosh," like, it's so funny how sometimes you forget, like, how much you align with something, like, the desires and fears are just so freaking spot on.
Mhm.
So spot on. When I was looking at that, like, ones wanna be virtuous, ooh, words are hard, ideal driven and accurate, and do things the way they believe they should be done. Fears. One's fear being bad, wrong, and or corrupt, or being condemned for doing something wrong. 100%. The idea of me doing something that would be corrupt, like, makes me want to like throw up. Like,
Mhm.
I would know. Hence why the world's been hard.
Mhm.
Hard to watch. But
Right.
no, I was just like so interesting. Like, gosh, this person really does know people, huh? Okay. I don't know. Just cool, like revisiting it again. This has been really actually, I feel like helpful for me in
Yeah,
this
what
season.
what book are you reading out of? Can you hold it up?
Oh, the Enneagram and You.
Okay. Do you know who the author is?
Who is the author? Da-da-da. Gina Gomez.
Okay. I'll try to link it in the description.
it's just very this is a really great book for just, like, the lay person who,
Mhm.
like, maybe doesn't wanna commit to reading The Road Back to You, which I still know that's still, like, a intro, but this is just
Which
super simple,
I
like,
have right there on my shelf right behind me.
"Oh, very nice, very nice." No, I just thought this was super simple, and it's been really helpful. I love things broken down in, like, little chunks. That's kinda
Yeah.
how I, like, learn things. It almost feels like a course, what this
Mhm.
kind of book feels like.
Mhm.
Yeah, that's been helpful to kind of revisit that, and I feel like it's always nice revisiting, like, why we do what we do, right?
Mhm. Mhm.
Yeah,
Yeah.
that's probably all I got.
So, once again, I'd like to thank my good friend Nicole Vega for taking the time to share her awesome insight and fun stories about what it's like to be a clinician from the perspective of an Enneagram 1. And for those of you who made it to the end of this video, I appreciate you so much. I know that this was a little bit of a longer one, but there was just so much good stuff in our conversation I had to share with you. I'm also going to link below a couple of books and online resources to help you better understand your Enneagram type and the Enneagram types of those around you. I'm so excited for the rest of this series, and I can't wait to see you guys in the next video.